topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Philadelphia. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. I got to tell you, Philadelphia is really dear to my heart when it comes to Ask the Experts. We started Ask the Experts 15 years ago, and Philadelphia was one of my first markets. We were on, I believe it was 806, the station at the time. It was a Beasley station, and we had so much great success with them. But radio's kind of dying out, and now podcast is the way to go. So we went with a new, not a new company, an established company. And here we are. And I got to tell you, we get so many people asking us, do you actually read our emails? And we do. And that's how we got today's expert, because we had so many people. There is a new, I would say, a health area, and it's called functional medicine. And we had so many people ask us, we keep hearing about functional medicine and testosterone and hormones. And we found one of the greatest experts in Philadelphia. Good morning, Dr. Katie Harris.
Hi.
We're so good. Well, hey, it's really true. It's we had right after your last show, we had a gentleman who works out, and he was doing testosterone through the mail. And he said, you know what, after hearing your show, I am going to make an appointment with Dr. Harris, because I really need someone who really understands testosterone and hormones. And you should be getting a call from him soon. But that's just one of the few things you do. Tell people about Philly Wellness Center.
Yeah, so we specialize in hormone therapy, weight loss, and really just the diseases that nobody else wants to take care of or can't take care of, or conventional medicine's not working for. And one of those is long COVID, Lyme disease, like fibromyalgia, those types of conditions. We do a really good job at helping people with those.
So, this skinny injection is become such a big deal. What are your feelings? I actually got an email this morning when they saw that your show was going to be coming on. Do you like the skinny injection?
So skinny injection, we're talking about semaglutide, tirzepatide, retatrutide, those types of, those are hormones. They're GLP-1, which is a hormone that's found in the body, in the gut, and the brain. I love them. I was on them myself, lost 50 pounds. It was one of those things where you just, you didn't do anything differently. You just got older, and all of a sudden you're 50 pounds heavier for
Yes.
no good reason.
Exactly.
Yeah. Yeah. So it's been great. And we use it because they have a lot of properties, like anti-inflammatory properties, and they do a lot of things for the body. It does actually preserve muscle. So all the GLP-1s, they're amazing, and we use them for things other than just weight loss. We use it for, like I said, pain mitigation because it helps with anti-inflammatory.
Which I know there's 3 or 4, maybe 5 companies that produce. Which one do you like best?
So we get ours compounded in a compounded version. So yeah, there's a bunch of different pharmacies that will make them.
So we know what's in there.
Yes, exactly. I mean, the base is the hormone, and the hormone they can't patent.
So I got it. So I have to ask you, I don't mind admitting it, I'm on Ozempic, and I want people to know that I've been on it for about a year, and I want people to know I just got my blood work done last week, and it has never looked so good before, and I have to credit it to Ozempic.
Yeah, definitely. So it's improving people's labs, and we see people all over the map. Like my sister had fatty liver; she had all kinds of issues going on, but her labs normalized after being on the semaglutide for several months. And myself too. Like I feel like just because I was on it for about a year, and it changed everything. Like I didn't do anything differently again.
Right.
It came on and then it came off just as easily with it. But that motivated me to, all of a sudden, once you drop 20 pounds, it's kind of like, oh, I've got a lot of energy. I want to go do something and then you get into these habits of working out and exercising, because that part is a big part of it as well.
I'm amazed what it does to your appetite as well. I have to admit, I was one of those guys who could eat a large pizza. Now I'm lucky to do a slice and a half.
Yeah, it reduces the food noise and the craving. And one of the weird things is when I first started it, it was like, my sister and I would be like, let's go do something. But our culture is so focused on food that the only thing to do is to go somewhere to get something to eat. That's all we could think of. So it was a mentality focus, like refocus as well. Like we need to do other things other than go eat.
We just got our first text, and I don't know why we don't have it on there. What is your phone number for the office, Dr. Harris?
The phone number is 215-709-9710.
9710?
Yes.
709-9710?
Yes.
Okay. I'm going to have our great producer get that up on the scroll. But for the people who are listening on iHeart and Spotify, it's 215-709-9710. Let's talk about testosterone. I got to tell you, Dr. Harris, I was amazed that younger people can have low testosterone.
Yeah, no, I think that it has a lot to do with our environment and heavy metals, toxins, endocrine disruptors, like all the stuff that we hear about. And the more you hear about it, it's almost kind of like, oh my gosh, you can't go anywhere or do anything without being exposed to all of this stuff. I mean, there's microplastics in anything that's plastic. So your plastic bottles, your food wrapped in plastic, and all of that stuff has nanoplastics in it. So that becomes extremely problematic. And then you have endocrine disruptors, which are a mimicry of the environment that already exists out there. So it becomes one of those things that the body has receptors for it, and those mimicries the endocrine disruptors can latch onto that and displace, your actual hormones from being there, and the body doesn't produce as much. So we are seeing it. Like, I have some young guys in their 30s, and they're not you don't want to start 30-year-olds on exogenous testosterone, because then the body shuts down making their own. So you have to look at ways to help these guys to rebuild their testosterone. Naturally your testosterone is going to go down with age, but that shouldn't happen until you're 50, 60, 70, not 20, 30. That's where you should be at your peak testosterone levels.
What causes the levels to drop over time?
So, I mean, there's the natural aging process where your organs just are making less and less of whatever. So, and women make testosterone too. That testosterone is the dominant hormone in a female. It has like 3,000 functions, and it's made by the ovaries for the most part. And when you go into ovarian failure, then you're going to have a shutdown of testosterone. And when we measure women's testosterone levels, it's usually like 2 or 3 by the time they're 50. And our goal is to get them back up to 100, because that's where they should be. That's where they feel optimized and they have the most energy. Men, on the other hand, as they get older, their testosterone is made by the adrenals, and the adrenals do a lot of things. They make a bunch of different hormones, your norepinephrine, adrenaline, cortisol, and they start to decrease as more and more stress is placed on them. To produce more and more. So they make less and less testosterone. And also the testes make testosterone. But, so you get less and less testosterone just naturally over time. But you shouldn't have that when you're 20 and 30. You should be at your peak performance with that.
How does a person know that they have low testosterone? What kind of symptoms would they have?
So it can be vague, or it can be pretty profound. So testosterone is responsible for muscle. So guys, particularly when they're in their 50s and 60s, will say, I've been doing the same workout routine and I'm not getting the same results anymore. They have to work like 10 times harder to just achieve their baseline. But you need testosterone to build muscle. So as your testosterone level goes down, your workouts become harder and harder and less effective. You might be tired, gaining weight, because testosterone regulates your metabolism. So when your metabolism goes down, you're going to gain weight. Mood disorders. So anybody, the first thing they do for women in menopause is put them on antidepressants, because they have mood disorders, right? They come in and they're like, they won't describe it as a depression, but they feel like apathetic. It might be the best word. So conventional medicine puts people on an antidepressant. So that's a sign too. So anybody that's complaining of mood disorders, we take a look at testosterone. It may be the cause. It may not be the cause. There's a lot of reasons for mood disorders, but if it comes on all of a sudden and you're 50, that is a big red flag for low testosterone.
What happens if a person has low testosterone and they literally do nothing about it? Can that hurt their health issues?
Yeah, I mean, because testosterone and estrogen. So, I mean, men and women both have testosterone and estrogen. We don't normally replace estrogen in men, but we do replace testosterone in women. They're both really important, and they have huge roles in the body. I mean, hormones take information from one space and deliver it to another space. And that's really the definition of a hormone, is, something that is made in one place and functions in another place. And you have a lot of hormones in your body, and testosterone and estrogen are just two of like 50 or 60 that we know of. So, the purpose of testosterone and estrogen is really to build muscle. It builds bone density. Nothing compares. No drug on the market comes close to touching what testosterone and estrogen do for bone density increase. So they maintain your bones. So that's very powerful. They keep the cardiovascular system clean and clear. And it's the research is showing that there is a mitigation of cancer risk when you have testosterone and estrogen on board. And if you think about it, it makes sense, right? Like 14-year-old girls don't get breast cancer, right? They're protected from breast. You don't get breast cancer until you're 50 because you've lost your estrogen, right? Same with men. Typically 14-year-old boys who are at the peak of their testosterone levels don't get prostate cancer. They don't get prostate cancer until their testosterone's in the 200s.
We just got a text, and we don't diagnose anybody on this show. This is an educational show. We bring you an expert in this field in Philadelphia. Even if you're in Pennsylvania, you can contact Dr. Harris's office. This is really a great text that we just got. Her name is Melanie. She's from Philadelphia. She said, I can't believe I found this show. This is God said. I am so glad I found it. Here is my problem. I am 67 years old. I do not have an appetite, so I eat very little. I have a hard time going to sleep, but my reason for writing is I'm gaining weight when I should be losing weight on the amount of food I don't eat. That's a good one, isn't it?
Yeah. Yeah, and it's a common one. Yeah, we definitely see that as you're old and as you age. But one of the issues is there's a component of hormonal issue in there, but there's also a component of mitochondrial dysfunction that exists in there as well. So as you lose testosterone and estrogen, you increase insulin resistance. When you have insulin resistance, everything that you eat basically comes in, but the cells have said, we don't want this, right? So then you have glucose hanging out in the blood, and that can be life-threatening, right? Because if you have too much glucose in the blood, you can go into a diabetic coma, and that's your extreme outliers. That doesn't normally happen, because what does happen is the pancreas creates insulin. Insulin's another hormone. So insulin comes and says, all right, guys, you can't hang outside the cell. You're loitering. You can't stay here. So it picks it up, and the only thing it can do is deposit it as adipose tissue, which is fat, right? And it's very energetically demanding for the body to break down fat. So it says, you know what, I'll do it another day. When I have enough energy, when I have enough food on board, when the cells are satisfied, then we'll start breaking down fat. So that starts to build up. And as we age, surprise, your mitochondria become dysfunctional, or you don't have as many. And if you're not exercising, that becomes an exponentially more and more of a problem. So you have fewer and fewer mitochondria, which are your powerhouses in the cells. You have insulin resistance. So the cells are like literally starving to death, but they're still saying no to the glucose. It won't let them in. But the other problem is fatty acids. If fatty acids can't get into the cell, then those get repackaged as adipose tissue as well. And that the reason that they can't get in, it happens a lot in patients that don't have the right amino acids on board. So if you don't have enough carnitine on board, if you don't have enough taurine on board, and a lot of this comes from the fact that many people take antacids. They take antacids and then they don't have any stomach acid. If you don't have any stomach acid, then everything you eat doesn't get broken down properly. And then you get stomach issues. And, now you don't have the amino acids because they didn't get broken down in stomach acid. So it's a big, large, complicated problem. But the fact of the matter is that there's a pretty straightforward path back to health. It just, there's a lot of components to it, and it's just one of those things that we need to look at and assess and give you that roadmap back.
We just got 2 questions. This is amazing. Both basically the same, wanting to know basically how much does stress have to do with weight gain?
Yeah, stress is cortisol. So there's 2 hormones that I could give you that would make you fat. So insulin is one of them. if, you know, when diabetics start insulin, the first thing they do is gain 10 pounds, like literally in 2 weeks. Nothing different. All they did was get insulin injections and they gained 10 pounds. The other one is cortisol. So if I give you prednisone, I mean, you've seen people on steroids, right? They get fat. It's just
Yeah.
the way it is. And, you know, I've had patients on tirzepatide, like high doses of tirzepatide, and they're not losing weight. Come to find out, they're also on high doses of prednisone for, I don't know, Crohn's disease or ulcerative colitis. And it's kind of like, well, I can't overcome cortisol. Cortisol is just too powerful. And when you have cortisol on board, it makes it, you know, it increases insulin secretion, you increase insulin resistance. Now, you know, everything you eat is being stored as fat again. So, I mean, stress is cortisol. It's your own cortisol that you're making, and also progesterone regulates cortisol. When you lose progesterone as you go into older age, then cortisol is more. It's running. I say it's running amok, right? Like people, and it leads credence to the stereotypical, you know, crazy menopause woman, right? That's flying off the handle. Well, that's a lack of progesterone and an overzealous cortisol surgeons.
Mickey wants to know, she's also in Philadelphia, wants to know, what is the difference in the estrogen you buy over the counter versus estrogen you prescribe?
It's going to be strength. So whatever you buy over the counter is not. I don't know what's in that. And
Yes.
you know, it's regulated. Like estrogen is a prescription regulated compound that needs to be made. So it needs to be prescribed by a provider. And so if you're getting it over the counter, it's not a high strength. We go for a goal of 75 to 100, which even, you know, compounded creams and patches and pills aren't going to get you to that level. The only way to get to that level is through pellets, inserting the pellets. But if you don't have that level, I mean, the creams might help with some symptomatology like hot flashes. But even that, generally, when people switch over from creams to pellets, they're like, "Oh, this is a way different experience."
Dr. Harris, I know because you mentioned on your last show you really like the pellet. Tell people what the pellet does.
So the pellets, they're about the size of a grain of rice, and actually the estrogen itself is so small. Like I always have trouble like trying to pick it up because it's so tiny. But we place those under the skin on the back side. So I make a very tiny incision and then just drop them in there. And they're dropped into like a fat pocket. And then, you know, we just tape you up and that incision heals over a couple hours. It's really fast. And then what happens is your blood capillaries will wrap around them and the body uses what it needs when it needs it. And we use bioidentical pellets that are made from a yam plant. And the yam plant's got a very similar chemical structure to human hormones. So the body can't tell the difference between a hormone that I give you versus a hormone that it makes itself. So it's readily accepted, utilized very quickly. And a lot of people feel the effects of it within like a day or two.
So it actually gives you a lot of energy, right?
It does, and it sustains that energy. So you peak out on the you know, if let's say I give you 10 milligrams of estrogen, you'll peak out at that 10 milligrams of estrogen, and you stay there for about 3 to 4 months. There's no kind of like up and down and up and down. Like a lot of guys, for instance, will take testosterone injections, but those are once a week, or sometimes they'll take them twice a week. But it's like you inject, you get this huge surge of testosterone, and then it wears out in the body like in a day, and then you plummet back down. Then you give yourself another injection, and you have this surge of testosterone. So it's kind of like this up and down and up and down. Whereas guys that get pellets, they hit their max where they're going to be, and they actually stay there for 6 months, and then they'll start to taper down slowly. So it's one of those things where they'll call me and they're like, you know what, I think it's starting to wear off. It's time to redo the pellets, and that will generally for men be about every 6 months.
I want to tell everybody, we've got about a minute left. I want to tell everybody, um, don't try to treat yourself. You hear all these advertisements on TV now or on the internet. You can buy the skinny injections from them, or you can buy estrogen from them. And it's so important that you make an appointment with Dr. Harris and be under a person who is an expert in this, from the formulation of the skinny injection to a much stronger estrogen, and someone who can really understand your problems. And I just hate it when people look at, these companies, these advertisements. Dr. Harris, how do people reach your office again?
Well, they can call us at 215-709-9710, or they can go to phillywellnesscenter.com and they can book an appointment to speak to our patient coordinator. They can message us through chat. They can email us at info@phillywellnesscenter.com. So any of those ways will get to us.
Dr. Harris, we're so blessed to have you. Dr. Harris is with us every month. Hey, listen, you got a great show when you got people writing and saying, how come the show is so short? That's a compliment to you, Dr. Harris. Hey, we'll see you again next month on Ask the Experts.
Thanks.
Thank you, Dr. Harris. That's Dr. Katie Harris, Philly Wellness Center. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Experts show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.